Why is it necessary to remove wisdom teeth? Why give so much trouble? In this video we tell 7 things sure you did not know about the third molars. 1. What are they and why do we have? They are known as third molars, and there are some theories that say they are vestiges of human evolution. That is, that because we have access to more processed foods, more prepared foods, and it is conditioning us less effort to chew, and this leads to less development of our jaws. Consequently, it appears that the eruption of the third molar, in many cases, does not have enough space in the jaws and complications can occur. Also, increasingly they begin to detect patients who lack this kind of wisdom teeth. 2. Why suggest removing wisdom teeth? Currently they are not practically functional, as explained in the previous section, but the main reason is the difficulty in maintaining proper hygiene. Often they end up developing infections, tooth decay or gum inflammation that end up affecting adjacent teeth, which themselves are functional and necessary. The recommendation to remove it because it leaves a more hygienic area and avoid future complications. 3. Why are we infected? They are infected for several reasons, one of them precisely because of its difficulty to clean them properly, but one of the main reasons for their infections is the lack of space they have for their eruption. This causes not have a proper eruption, are twisted and thus promotes retention and difficult food hygiene. Another consequence of this lack of space is the gum surrounding this type of wheals. The gum surrounding our teeth is a type of gum that must be closely linked to the tooth, known as keratinized gingiva. In the case of wisdom teeth at a lack of space, they are often partially surrounded by a mucous membrane. It is not properly attached to the tooth and it favors the entry of food and facilitates infection. This process is known as pericoronaritis. 4. When to remove wisdom teeth? The best time to remove such molars is in early stages, i.e. when they have not yet formed its roots. This is usually around 12-15 years old. At 18-25 years is its eruption, and then have the roots formed, and this can always complicate their extraction. 5. Differences between the upper and lower molars. There are 2 key differences. The type of bone in the maxilla there is fluffier and easier to remove, for otherwise the jawbone is harder. The jaw accommodates the dentral nerve. Take care that the roots of the lower wisdom teeth are not close to this nerve to avoid injuring if we extract this kind of toothache. 6. Is it true that move teeth? The eruption of wisdom teeth has always been associated with moving the adjacent teeth. It is true that a lack of space exert a force for eruption, and this may influence the movement of other teeth, but some items are showing that patients without wisdom teeth also have this kind of movement of other teeth. That is, the movement of adjacent teeth can come conditioned by many factors, not only by the eruption of wisdom teeth. 7. Always should they take? About whether they should be removed or not, you need to make the right controls for your dentist confidence, from an early age from 10-12 years. At this age there are many children who have no space for the eruption their own teeth properly, then it probably will be indicated extracting wisdom teeth. There are cases that if there is enough space and associated with proper hygiene of the person, could keep track of this kind of toothache, or there are cases where these are impacted tooth in the jaw, and not contact with the oral environment. Having no contact with the oral environment is difficult to become infected. If not bother, you can control is not strictly necessary to remove them.